Now I invite Dr. Bhavik Panchal. He is speaking on Sibling Bond, a tale of two brothers with CMV Retinitis.
So, good afternoon, everyone. Good afternoon to the judges as well, the panelists. Yeah. So this case is a case of a 4-month-old baby who was brought to us to a clinic by the parents, saying that the child does not have the same eye contact how the child had 15 days prior. It is quite unusual for a mother to get this complaint, right? Normally, what mothers say, you do believe it with a lot of caution. So, or rather, you pay a lot more attention to it. So, if you look at the fundus photo of this child, so this was a healthy-looking child. Uh, Weight was as per the age. What we noticed was both eyes necrotizing retinitis with multiple hemorrhages, presence of vasculitis, right? And you have full thickness necrotizing retinitis as well as few of the granular variant as well in certain areas and interspersed hemorrhages. The disc in the right eye appeared a little pale with some vasculitis or skip vasculitis which was noted here. Left eye disc was apparently normal. Okay, so unusual to have a diagnosis is straightforward CMV retinitis, but to have it in a 4-month-old child is something unusual. So we went back to look at the family history. Elder sibling also presented with both eyes retinal detachment, exudative detachment, and underwent a vitrectomy. And during the vitrectomy, the child was diagnosed as having both eyes CMV retinitis. Now this child is 4 years of age today. Child took treatment for intravenous ganciclovir for the CMV infection. So the mother was advised to visit ophthalmologist in case of future pregnancies, and this was the second pregnancy. We examined the child at age 1 month, child was normal, and at the age of 4 months, the child came to us with this profile. We went ahead with the mother's and the child's torch profile. Even the mother came with us with the torch profile during pregnancy, which was negative. Okay, so a fulminant variant of CMV retinitis was diagnosed, and when you look back at the reports of the child, right? So after this, the child was referred to the pediatrician to rule out any systemic CMV involvement, and also started on intravenous ganciclovir as per the body weight. Torch titer was positive, IgG and IgM for the child, CMV and HSV both. Urine PCR was CMV was positive with a very high viral load. MRI brain was normal. Rest of the things had USG abdomen showed hepatosplenomegaly. Right. Rest of the things were fine. The child also had skin blisters noted 2 weeks after starting the treatment and was treated antibacterials. Now, such a child with the elder sibling also having CMV retinitis in the neonatal age, we thought that something is abnormal with the immune system. So, we went ahead with a test to rule out any severe combined immunodeficiency or a T cell mediated immune deficiency disorders, and we found out that the child had in the whole genome sequencing showed that there was a homozygous likely pathogenic variant in the LCK gene, right? So this child on follow up with IV ganciclovir, uh, definitely CMV retinitis is resolved, but the optic atrophy set in, and we know that LCK gene is important for the T cell functions, okay, and this is where the important point comes in here. Recognition and high index of suspicion is extremely important for a common condition to present at an abnormal age, right? So timely referral, diagnosis, and early treatment can happen. The child was further treated with IVIG. Unfortunately, the child could not sustain and succumb to the systemic involvement as well. So this is a short case about how genetic mutation can lead to a severe combined immunodeficiency, leading to a systemic infection which was lethal in this child. Thank you so much.
What was the CD4 count?
CD4 count was normal for the age.
Actually, this is a kind of a combined immunodeficiency syndrome, and they can lead to that opportunistic infection like cytomegalovirus retinitis.
Yes, it's true, sir.
The patient need to be treated systemically also.
This patient was treated systemically.
Thank you. Thank you. Nice.
Thank you so
nice
much.
Case.
Thank you so much.